Hi, I'm Mark Strong. I'm the Business Development Director for Multi-Radiance for Human and Veterinary. And I have my brother of another mother today with me, John Bruno. John, your responsibilities include?
I'm the Clinical Director for Sports Medicine Rehab, the Government and Military, and I'm also responsible for training.
So here today we're going to talk to you about Class 4 lasers. What is it? How does it relate to getting benefits for outcomes? What does this mean to a practitioner so that you can anticipate some of these issues before you're out in the field? Because there's a lot of misinformation out there, John. So let's talk first, what exactly is laser therapy?
Laser therapy, or another name as it's known by, is photobiomodulation, whereby it's a process where we're using light to stimulate biological processes. And then from there, we're getting other effects that take place, like pain management, controlling inflammation. That's what we're looking at, as well as helping to improve local blood circulation.
So basically, you're talking about photochemical effects in the respiratory chain of the mitochondria, photophysical effects.
Correct.
But what about photothermal?
Photothermal effects is really set aside for laser surgery and ablative types of laser devices, such as removing tattoos, laser surgery.
But we don't need photothermal to get a good laser therapy outcome?
Photobiomodulation is a non-thermal process. It's based on these photochemical and photophysical effects that Mark is talking about.
But don't we need the brightest possible light to get the deepest effects and the greatest number of photons deeper into the tissues?
That's going to be determined really by the wavelength. Wavelength is the primary factor in depth of penetration.
You can't just drive them through the skin with more power?
All the power in the world isn't going to matter if the wavelength isn't sufficient to get the light deep into the tissue.
So this is why I can't cook a turkey 2 hours faster by cranking it up to 500 degrees?
That is correct, just like if you're going to bake a cake. Think of laser therapy as really following a recipe. There's certain mixes of ingredients that you have to put together to produce the specific effect. This is really referred to as biphasic dose response. And what that essentially says is you have to produce enough of a stimulus to get a response, so you have to cross the threshold. Then the more of a stimulus that you produce, the greater the effect, until you produce too much of a stimulus where you're either going to suppress or inhibit that response from occurring.
So this is one of the great paradoxes, because sometimes we have to deprogram clinicians. When they start using our laser, they're so accustomed, if I can borrow your arm,
sure,
they're so accustomed to doing this, right? Because if they go too slowly, you're probably going to say, ouch, right?
Correct.
So they have to keep moving this, and then maybe they're doing it in a patch grid or back and forth. But how can you get a reliable, consistent dosimetry when you're moving it around all the time? But of course, if you don't, the thermal effects start to take over.
Correct, and that's one of the downsides of using a high-powered laser. The rate that you're going to be scanning with that emitter is going to be different for each individual in your clinic. With a multi-radiance laser, you're going to use a static contact technique, which is really the gold standard for applying laser. You know that you have a certain amount of energy coming out of the emitter. There's a certain time frame that you're going to be doing the dose for based on whether you have to stimulate or inhibit. And then that dose is going to be anywhere from about 80 seconds up to about 6 minutes, depending if it's a stimulatory dose or whether it's an inhibitory dose.
So all laser therapy starts out stimulatory. But there's a crossing point. There's a really jumping the chasm point where all that stimulation has now become inhibitory. So the more energy you start with, the faster you're going to cross over and get into the inhibitory side. Is that right, John?
Correct.
So if we want to stimulate, then low and slow would be the way to go, correct?
Correct. And what laser therapy really is all about is stimulating biological processes. And a little energy goes a long way. So really, there's a cascade of effect that occurs as a result of laser therapy.
So you want to learn the Arndt-Schultz curve and be intimately familiar with it, because it states very simply, if you increase the stimulus, you increase the response. If you increase the stimulus again, you increase the response, but it's going to follow the inevitable bell curve. The benefits start to plateau out. Now you start to generate adverse effects.
Correct.
And unfortunately, can we tell when these thermal overloading things begin?
With the Class 4 device, they oftentimes will talk about being able to treat a condition in maybe 30 seconds, so you just turn it up. Well, the Bunsen-Roscoe law of reciprocity says that doesn't apply to joules, because joules is an inaccurate way to dose. Dose is primarily a factor of the parameters of the device and the time you're going to be doing the treatment for. So for example, if you want to do a treatment in 30 seconds, they're going to recommend that you use several thousand joules. Nowhere in the peer-reviewed literature anywhere documents the use of those jewels for treating many different conditions. But what you are going to do is generate more heat in the surface, and that's setting the person up to create some toxic effects which can lead to apoptosis. And apoptosis by definition is cell death, and it's nonspecific.
And those effects can begin at about 42C.
Correct. But you could go immediately into apoptosis with an additional of 3 degrees Celsius. So once you start approaching 42 degrees Celsius, you're causing cytotoxicity. And once you approach 45 degrees Celsius, then you're reaching apoptosis.
So on the one hand, you have a class 4 laser, and you can't tell when you're starting to thermally overload those tissues, and you have to keep moving it. Now, some of them have a standoff, a little cage on it. Some of them have a roller ball on it.
Correct.
Which also introduces things like air dispersion or this mass that it's going through. But the reliable, precise dosimetry seems to be rather elusive. But now let's switch over and talk about the requirements from an OSHA perspective. And when you get a knock on your door from somebody with OSHA, they're typically looking to fine you. So John, what are some of the issues? I know we pulled up this page from the OSHA website, and this is one of the ingredients in your sales kit. This is a page with which you need to become very familiar and have the link that you can pass on to people you're talking to. Chances are, about 90%, they don't know all of the add-ons that they have to include.
Correct. And a lot of times the Class 4 manufacturers aren't going to tell their customers all the safety controls that have to be put into place.
As an example?
One of the basic ones is wearing goggles. There are many times where I'm walking into a facility and they're using a Class 4 device and they're doing it out in the middle of the training room or in the middle of a physical therapy clinic, and neither the clinician or the patient has goggles on.
Well, why do I need to worry about that?
Because there are ocular hazards associated with these high-powered lasers.
What is an ocular hazard?
Hazards to the eye, potential hazards to the retina of the eye. I was talking to a laser physicist from an Air Force base one time, and I was working with one of our customers. I was doing an in-service, and she had asked me if I could do some live demonstrations on actual patients. And this one patient that came in, he asked me why I'm not wearing goggles and why I'm not putting goggles on him. And all I said to him was, we're a Class 1 laser device. He goes, oh, okay. You would not believe the severity of the eye injuries by people using these high-powered Class 4 lasers without goggles.
So when you go to the website and you dig into what a Class 4 can do, one of those serious issues is vaporization of water in the cornea, or retinal damage, or the thermal overloading process that takes place in the tissues. And as John mentioned, 42C is where these harmful processes start to kick in. You can very quickly hit 45C, and then some really nasty things take place. But unfortunately, you won't know, and neither would the customer. So it's very important to understand the underlying risks of using a Class 4, and more importantly, understanding the Class 4 is only a designation of these hazards and has nothing to do with efficacy whatsoever. So in addition to the goggles, which is pretty simple, if you have a Class 4, you're required to put it in a blacked out room, a dedicated room with blacked out windows. Now, you also need to have hazard alarm system, so that if there's an inadvertent entry into the room, the laser will shut down, again, because of harm that could take place in a matter of seconds.
Correct.
There has to be an alarm system on the machine as well. In fact, at conferences today, a form gets passed out that you and an exhibitor need to fill out that asks very simple questions. Do you intend to demonstrate a laser? What class is that laser? And now, if that class is a 3B or a Class 4, you will be required to have it in a protective enclosure or don't turn it on. So one of the other great advantages of a super pulse multi-radiance laser, in addition to being able to carry it anywhere, is to be able to use it anywhere without fear of anyone else being harmed. And certainly the most important tenet for any healthcare practitioner is do no harm.
And that's a cardinal rule in any type of healthcare setting. So whether you're a nurse, whether you're an athletic trainer, physical therapist, a doctor, chiropractor, it really doesn't matter. Doing no harm is the primary tenet of treating patients.
So let's sum it up. Safety, hard to beat a Class 4, hard to beat a super pulse laser because it's about the pulse durations. You're talking about nanosecond pulse durations, that's billionths for the unschooled, and it takes a millionth of a second or longer to start getting these heat registrations in the tissue. At a billionth of a second, can I cause any thermal overloading?
Nope.
Impossible, right?
So we're going to be inherently safer. we're also going to be inherently more effective. And the reason why I say that is if the rate of these high-powered, if the rate of delivery on these high-powered lasers is greater than the rate of dissipation and absorption in the tissue, you're going to cause tissue heating. And as I mentioned earlier, one of the primary parts of the definition of photobiomodulation is that it's a non-thermal process. So if you're starting to feel heat in the tissue, it means two things. The rate of delivery is too high. That's number one. Number two, the light isn't getting through. So are you really doing laser therapy? The answer is more than likely going to be no. So what the effects that people are generally feeling with laser from these high-powered units is more nociceptive relief. They're getting relief by stimulating the nerve endings to help provide more of an analgesic effect, which is essentially short-lived. Patients misconstrue that as getting a relief from their problem, when in fact, there's evidence to show that a multi-radiance laser is going to be superior in controlling muscle damage and tissue damage rather than a class 4 device. And that study was published online first in the Journal of Athletic Training in February of this year.
So can I at least go find a lot of class 4 studies to show that it is effective?
You might find some case series of studies, but the thing to remember about laser studies, or any study for that matter, systematic reviews with meta-analysis are considered your class 1 studies. Case studies are further down, and case studies really is a matter of subjective opinion and how it works on 1 or 2 patients.
So can I have a 2 controlled study with a class 4?
We haven't seen that yet because of the heat that's being
that be?
produced. Because you can't do a double-blind, randomized, placebo-controlled study if you have heat being produced. And that's one of the keys to remember.
But if class 4 is really the most effective laser out there, can I go to websites like, I don't know, the World Association of Laser Therapy or the North American Association of Laser Therapy and find protocols for a class 4?
Right now, the way the WALT guidelines are set up, we don't see those wavelengths being used in the class 4 devices as part of the dosing parameters.
You mean because they're not really considered low-level laser therapy?
That is correct. Low-level laser therapy, again, is anything below 500 milliwatts of average power. These high-powered devices, high-intensity devices, have mean outputs of power greater than 500 milliwatts. And we're seeing some of these devices that could produce as much as 15, 25, even as much as 60 milliwatts of average power, or watts of power. And that's not really a therapeutic device.
So is this why we're seeing the North American Laser Therapy Association, or I should say North American Laser Therapy of North America, is this why I'm seeing them change their name to photobiomodulation? Because that's a process that can only occur at low power levels?
That is correct. What we're doing is using light to modulate biological processes. And the processes that Mark is talking about, and also according to the thousands of studies that have been produced, these processes occur at low levels, generally around 100 milliwatt range.
So if I'm trying to stay in the stimulatory mode, and as you're going to learn, all laser starts out stimulatory. It's something you may have to turn it off rather quickly if it has a lot of power, but all laser starts out stimulatory and becomes inhibitory, which is something we'll talk about later, and we can use it to our advantage. But the stimulatory phase is especially important in things like wounds. If you're overloading those tissues with energy, you're going to set back the healing process. You're actually going to retard the ability. And let's face it, if you're putting in too much energy and you're causing deleterious effects, now the body has to recover from what you've done. You haven't added to the healing process, you've actually set it back. So you now have to get back to zero as well.
Well, there are cases that I have heard about, and I know some of our other reps have heard it too, that the patient likes the way it feels. The high-powered laser device manufacturers are going to say, well, they provide soothing warmth. Again, and you're going to hear me say this over and over again, photobiomodulation, part of the definition is it's a non-thermal process. It's not based on heat development. It's based on photochemical and photo changes within the cells and tissues.
So if you want to feel good from warmth, get a heating blanket, get a hot water bottle, but be careful using a class 4 because heat and laser not a good combination when it comes
Correct.
to laser therapy.
And that's what causes the apoptosis. It's the generation of, you have a lot of reactive oxygen species, which that's really getting down into the weeds, but it's important to understand what some of the method of action is of laser. So you're going to learn about reactive oxygen species, you're going to learn about nitric oxide, and you're going to learn about ATP production, which is really the building blocks of how laser works.
How it really works.
Correct.
So stay tuned. We're going to talk about priority principle next, but thank you very much, John. Class 4 lasers, the things you need to know, and the websites with which you need to become very familiar. Very hard to do a controlled study with a Class 4 laser. And now we have how many peer-reviewed studies?
We have about 12 peer-reviewed studies, and there's about 24 more being conducted in different parts of the world.
And how easy is it to get a peer-reviewed study published?
It's not very easy. It could take several years.
In the case of our most recent one on the muscles, with Dr. Tiago, about 2 years. It's an excruciating process to have peer review bless your study so that it can actually be published in a prestigious journal, most recently in the case of Journal of Athletic Training.
Correct.
So we'll talk about priority principle next. John, thank you very much.
Thanks, Mark.